basic arguments. Firstly, that it is possible to recreate a naturally occurring human disease in an animal, what vivisectors call an animal model of a human disease. This is, however, impossible. Diseases, artificially induced in animals, have nothing in common with naturally occurring human diseases, which arrive in people spontaneously due to a variety of, sometimes unknown factors. Although we do know that exposure to certain environmental factors and unhealthy lifestyles over a number of years are responsible for many of the diseases that afflict mankind. Vivisectors often talk about creating a similar disease, but in the world of true science, the word similar is meaningless. The second false claim of the advocates of vivisection is that it is possible to learn about the human body and how it works by looking at animals. For instance, vivisectors attempt to learn more about the human immune system, the inbuilt system that protects us from disease, by experimenting on animals. But the immune system of animals is different to that of humans. Dogs are able to drink from muddy puddles without harm, while cats are able to clean themselves by licking dirt from their bodies, and rats are able to thrive in the filth of the sewers. But not only is the human immune system different from animals, so is the human cardiovascular system. The structure of our skin and eyes, muscles and bones are also different. We are also different socially and have different dietary needs. All species are different genetically. The third false claim in support of vivisection is that it is possible to predict human reaction to drugs and other chemical substances by testing them in animals. However, animals can in no way predict the human response to drugs due to differences in the way each species will react to them, and the different rates at which drugs are eliminated from their bodies. In the UK, all drugs are first tested on animals before they're given to people. The consequence of this is that the newspapers are, on an almost daily basis, reporting the removal of one drug or another following adverse effects in people, having led to horrific side effects, injury and death. In 2004 it was reported in the press that prescribed drugs were the cause of 10,000 deaths in the UK each year, and in 2006 that as many as 250,000 people in Britain are hospitalized annually because of prescribed drugs at a cost of some £466 million. Needless to say, all these drugs will have undergone extensive animal testing. It has also been reported in highly regarded publications such as the British Medical Journal, the Journal of the American Medical Association, and New Scientist that prescribed animal safety-tested drugs are the third and fourth biggest cause of death in the United States and UK respectively. One of the most recent examples of animal-tested drugs that have gone on to cause damage to human health is Vioxx. Manufactured by drug company Merck & Co. and prescribed for the treatment of arthritis and other conditions, it was shown to be both beneficial and safe in animal tests, and yet went on to being suspected of causing as many as 140,000 strokes and heart attacks in human beings before being withdrawn. However, there have been many other drugs which have been found safe in animal tests and have subsequently killed and injured people. And some studies have shown that the figure of 10,000 deaths each year from prescribed drugs in the UK could in fact be much higher. One can only guess at the number of people who have needlessly died and will continue to die due to this reliance upon the false methodology of vivisection. In 2006 there was widespread news coverage of the 6 men who suffered multiple organ failure in the testing of a new drug, TGN-1412. This had been tested on rats and monkeys and found safe in doses 100 times greater than those eventually given to the human volunteers. Of course, the very fact that drugs must go on to clinical trials after the animal studies is proof in itself that animal testing is no guarantee of safety, and that ultimately human beings are the real guinea pig. In fact, the whole purpose of the safety testing of drugs and other chemicals on animals is to provide an alibi when they go on to kill and damage human beings. Then it can be said that all the required safety testing has been done, thus ensuring drug companies do not face criminal charges. Animal testing is done for legal reasons and not for safety reasons, and this is proven by the fact that substances shown to be hazardous to animals still find their way onto the market. The reason for this is simple. Animal tests are meaningless in regards to human health. Animals do react differently to humans and indeed to other animals to drugs and other substances. Not only that, but there can be huge differences in the way members of the same species react to a substance depending upon age and sex. What might be safe for a mature adult might be dangerous for a child, whilst that which is safe for men might well be dangerous to women. How much, then, must the differences be in the reaction to drugs between members of different species? Says Professor Crochet, the amanita mushroom, which is deadly to human beings, is a delicacy for rabbits. Lemons, when fed to cats, will kill them, as will the common aspirin. Prussic acid, the mere smell of which can kill a human, is a fine aperitif for toads and sheep. Strychnine has no effect at all on guinea pigs, chickens, or monkeys. Arsenic, a favourite among murderers, can be tolerated in considerable quantities by sheep. And whilst vitamin C is essential for humans, removed from the diet of dogs, cats, or rats, they will nevertheless remain healthy, as their organisms produce their own vitamin C. The list is endless. In the late 50s and early 60s, 10,000 babies were born with birth defects. Responsible for this catastrophe was the drug thalidomide, prescribed for women in the early stages of morning sickness and tested for safety on animals. As reports of malformations began to pile up, vivisectors went back into the laboratory in an attempt at reproducing the malformations in mice. The results were negative, and assurances of the drug's safety were sent to thousands of doctors. Only when it was no longer possible to doubt the drug's true nature in humans was it taken off the market. During the lengthy civil trial of the drug's manufacturers in 1970, numerous court witnesses, all animal experimenters, stated under oath that the results of animal experiments are never valid for human beings. In fact, the manufacturers avoided criminal charges because of this defense, that the results of such experiments are worthless, the very argument that should put paid to all animal experiments once and for all. One of these experts at the trial was the Nobel Prize winner Sir Ernst Boris Chain, who co-discovered the antibacterial effects of penicillin. According to the court records on 2nd February 1970, he stated, "No animal experiment with a medicament, even if it is tested on several animal species, including primates, under all conceivable conditions, can give any guarantee that the medicament tested in this way will behave the same in humans, because in many respects the human is not the same as the animal." Pro-vivisectionists have used the thalidomide tragedy as proof that more animal testing is required, as testing for birth defects was not mandatory prior to thalidomide. However, the truth of the matter is that animal experiments